Today, we will talk about the most common diseases in Thailand and how to prevent them. Thailand is a tropical country located near the equator, so the weather is hot and sometimes humid, which is the perfect conditions for mosquitoes to live in. There are also many stray animals that transmit diseases. Today, we will talk about the three. One of the most common diseases, which are dengue, malaria and leptospirosis.
What is dengue fever? Dengue is an illness that occurs in tropical and subtropical areas of the world, such as Thailand, and has flu-like symptoms and causes high fever.
What causes dengue? Dengue is caused by infected mosquitoes, usually the Aedes aegypti and Aedes albopictus species. These mosquitoes feed during the day, usually early in the morning and evening. These mosquitoes can be found near water built-up areas.
How can dengue be cured? Even though there is no specific cure for dengue, you can relieve the symptoms until the infection has gone. Here are some other things you can do to treat the fever.
See a doctor if you get a fever or have symptoms similar to dengue. Take paracetamol to relieve pain and control the fever, and drink plenty of water.
Malaria is a disease caused by a parasite. Malaria is a serious and sometimes fatal disease that commonly infects a certain type of mosquito which feeds on humans.
How do people get that diseases? People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illness. How is malaria transmitted? Usually, people get malaria by being bitten by an infective female Anopheles mosquito. Only Anopheles mosquitoes can transmit malaria, and they must have been infected through a previous blood meal taken from an infected person.
How malaria can be cured? In general, malaria is a curable disease if diagnosed and treated promptly and correctly. Malaria can be cured with prescription drugs. The type of drugs and length of treatment depend on the type of malaria, where the person was infected, their age, whether they are pregnant, and how sick they are. If you are traveling into the malaria risk area, the best prevention method is to protect yourself against mosquito bite. Use mosquito repellents.
Leptospirosis is a zoonotic disease caused by the sprotiate bacterium, which can infect humans and other mammals. With an estimated 1 million cases and 50,000 deaths each year, leptospirosis is one of the most common zoonotic diseases in the world. It can also be found in people who have an infected kidney. It causes high fever, muscle pain, stomach pain, and vomiting in those who become infected.
Thailand has leptospirosis. The most common leptospirus species infecting humans in Thailand is L. interrogans. Thailand reported the first case of leptospirosis in 1942. The annual number of reported leptospirosis cases rises from 398 in 1996 to 14,285 in 2000. How can it be cured? Antibiotics containing penicillin and doxycycline can cure leptospirosis. Some doctors may recommend pain relievers to you. You should be fine in about a week. You may still be admitted to the hospital to determine whether the disease is fully cured.
How to avoid it? Avoid touching items polluted with animal urine, such as animal bedding. Do not swim or soak yourself in floodwaters or water from lakes, rivers, or swamps. Confirm that the water is clean and safe to drink.